you. Um, Again, thank you, Nancy. Happy to be here presenting today, and everybody knows all about Zoom. You've been using it for a while, I'm sure. But anyways, the disclaimer today is that we're going to be providing some information today. It's not intended at all as medical advice, even though we have Eunice as an RN joining us today. But I encourage you to speak with your healthcare providers if any questions about your particular situation or condition. Okay. All right, so before diving into some of the specifics on how you can keep your loved ones out of the hospital, I'll provide a bit more about that story about my grandmother, how I joined the field, and then also why I wrote Thriving at Home. So yes, it's a book. We just published it last year. I worked on it through the pandemic, and I'm hopefully helping folks in the community keep their loved ones out of the hospital. So we'll get into some of the little bit more specifics about the book. We'll also cover how to find extra help at home, and then hopefully leave a little bit of time for questions, but informal today. Any questions that you have, feel free to jump off mute or whatever and ask questions as we go. Even though there's slides here today, it's more meant to be a little bit mute. Is that all right? That's okay. Everything's good. It's okay. Feel free to jump off mute unless Shuwen puts you on mute. Just using. In any case, Nancy had a great intro. So you have a bunch of my background. Grew up in Minnesota, moved to college in the Boston area for engineering, a couple different decades, but I am owner of Assisting Hands Home Care. We're a national franchise with over 70 offices. My office, is based in Bedford, and we're now in our third year in business. So my entry into home care, specifically, the story about my grandmother started as she was diagnosed with dementia about 5-6 years ago. She moved in with my mom and stepdad, and eventually, it became a little bit challenging for my mom and stepdad to care for her with, as the disease progressed. So she moved into a community and eventually into the memory area of the community. But towards the end, she did require some support from hospice. And with the hospice benefit, she was able to get some extra help in the mornings from caregivers who were able to get her ready, showered and dressed and ready for breakfast each day. I remember my mom calling back from Minnesota and calling me. I was in the Boston area, and she would say how impressed she was with these caregivers, that they were going above and beyond and helping my grandmother in so many amazing ways. Just things that she did not expect that they'd be doing. She's just very impressed. And I was thinking about how, if my mom is this happy telling me over the phone, there must be so many grandparents or parents out there that would need help like this. I just got thinking about, a business opportunity. And my wife and I have always wanted to start a business, but what kind of really inspired me to get into the field was I actually had a chance to meet those caregivers. I went back to Minnesota and met those caregivers that supported my grandmother during those final few weeks. I met them at her funeral. Not did she care, those caregivers care enough to attend the funeral, but they told stories on how they were able to keep her smiling in those final few weeks by doing her hair. She has curly hair. They did her fingernails, painted them up, kept her, in that difficult time, kept her dignity. But one of the aides even shared a story on how her grandmother was going through a similar situation. And she actually traded blouses. This is pre-COVID, but she traded blouses with my grandmother. And my grandmother got to be, wearing, the wearer of her favorite new blouse. And hearing those stories directly from those caregivers, it just truly inspired me. I was blown away by their consideration, their thoughtfulness, and just wanted to provide more of that same experience to as many other folks as I could. So I came back from that trip on the plane. I thought about trying to directly impact people's lives, and I researched home care and settled down with Assisting Hands because they're focused on quality. But we believe that all folks deserve that same level of care. I don't know, Eunice, if you want to give a little bit more background or anything else you'd like to add.
Um, like was already stated, I started off as a CNA too. I had a strong passion to help people, especially older folks. And along the way, I wanted to give even more. And so I decided to go back and pursue my degree in nursing. And I have ever since loved, the choice that I made to be more giving in the health sector. There's a lot to accomplish by helping other people. Just seeing the smiles that you bring to people's faces, just seeing the world of knowledge that healthcare actually presents and being able to impact that into other people's lives. I think that's very fulfilling for me. And I'm glad to be working with Dave hand in hand, helping folks in their home to stay safe and all of that. So we're happy to be here today.
Thank you, Eunice. So we'll take team presentation today, but Ian, feel free to jump in to ask any questions as we go throughout. So our objective this afternoon is to share some practical advice on how you can help keep yourself or your loved ones thriving at home and out of the hospital. Why did I write the book about preventing hospital stays? Well, many of us have the goal to age in place. And I look at that as live our retirement years where we want to live. That can be at home, or we move in with a family member, or vice versa. A family member moves in with us to help out with things, or it can be into an independent living or assisted living community. And in home care, I've seen firsthand how individuals can age in place. We'll speak a little bit more about it, but managing and maintaining your health at home is really key for staying out of the hospital or rehab. Hospital stays can also be very, very difficult, expensive, and cause possibly some unintended consequences, complications, or infections. And obviously, there's been a risk of COVID as well lately. But another reason is last summer, in the early spring, I did see family caregivers that were providing a lot of that support. And some of our clients went on pause from services, and a family member may have moved in last year, but not all of those family caregivers had professional training or certifications in providing care, and it was very difficult. We saw last summer for those family caregivers to take over and provide that support, particularly for challenges like dementia. It does require some level of experience and sophistication in terms of the techniques or approaches you can use. But they were still, a lot of them were shouldering a lot of the burden last summer, and I thought about sharing the knowledge and seeing all of the things that our caregivers do in helping care for folks at home. And these are just non-medical interventions that all folks can take. But the more I thought about sharing that knowledge should likely result in better health or hopefully more happiness for a lot of those folks living at home. A lot of the stuff, as I mentioned, that our care team does could still be used and help a lot of those folks at home. So more promoting awareness about the care options, including types of support at home, thought to be able to bring more awareness and help folks at home. So let's get right into the topics of the book. The areas of the book are really focused around keeping your home safe, preventing some of the causes that would lead you to go to the ER in the first place. So we'll talk about home safety, managing your health at home, really requires knowing when to escalate, monitoring symptoms. We'll talk all about going to hospital, because even though we're trying to prevent trips to the hospital, they can be needed and do provide the best care, but going to hospitals, prepared, can likely improve the outcomes while at the hospital. And it's likely that we go to the hospital during our retirement years in any case. All right, so specifically, home safety is really preventing falls is very, very important. Actually, the number one reason why older adults go to the hospital in the first place is because of trips or falls at home. The good news, though, is that most falls are preventable. However, we do need to see the hazards in the home. So ensuring that there is proper lighting in the home. And ideally, before you enter the room, you can flip on the light switch as opposed to after you getting in the room and then flipping, turning on the lamp or something like that. Also, as we age, our eyesight does change, and making sure that we have regular eye exams will help make sure that we can see those hazards. Once we identify the hazards in the house, the key thing is to remove those hazards. And in looking at the diagram on the right here, there's no loose rugs around the rooms. So making sure that throw rugs or uneven floor transitions are addressed as much as possible. Also using supportive equipment, you'll see particularly in the bathroom near the tub and near the toilet, there are grab bars. Another item to think about in the bottom right is the stairwell is making sure that you could install a second rail so there's a railing on both sides of the stairs, or some of the types of improvements you can make at the home to make it easier to go up or down, should one side be stronger or weaker and so forth. A key thing to staying at home and preventing falls is to maintain your strength and balance. In doing so, exercise is so critical to having that strength so that you can get around safely in the home. Even going up and down stairs is helpful. In our approach, we'll talk a little bit more about it later, but when you get outside help, ensuring that help supports everything you can do and maintains your independence, so that you're able to continue doing as much as possible, and only providing extra assistance where needed will help keep you doing, or your loved ones doing, as much as they can to avoid those falls. But it requires the strength and the balance. Likewise in the kitchen, on the bottom left here, putting commonly used items like mugs or bowls, not in the upper cabinet, but just on the countertop, or locations that are much easier accessible, so that you're not reaching off balance to grab something. It's just some simple actions to take, but kind of going through the home. And this is stuff that we'll do to start up clients, is we'll go through and do a home safety evaluation, depending on the level of risk in the home, or the risk of, in terms of falls for our clients. But making sure that everything is kind of reviewed is key. Obviously, cords and other trip hazards are other big causes for falls, so making sure that everything's tidied up in each of the rooms. Just a quick note here, I have tips throughout the slides here. In chapter 1 here, I mentioned that there's additional information and things you can gather. No need to write all these things down. I'd like to, in joining the presentation today with the Rotarians, you guys do so much in helping other folks. I'd like to offer a copy of our book, Thriving at Home, a complimentary copy for all of the Rotarians today. So I don't know if there's a way, Shuwen, that we can just get, or I'll have an email address later that you can email if you're interested in a copy. Email me your address and I can drop one in the mail, or we can coordinate how to get a copy.
That's
but
great.
I'm happy to help. You guys do so much for others. It's the way I can help you or your loved ones. So moving on, Eunice, would you like to start managing health at home?
Sure. So the first step in managing your health at home, or your loved one's health at home, is identifying any new diagnosis, any chronic conditions that they may have. One of the major chronic conditions, and this is not exempt in others, but the key major conditions that drive people back to the hospital includes diabetes, includes heart failure, chronic obstructive pulmonary disease, which is COPD, as well as stroke. So once you identify these chronic conditions, it would help you to be able to help manage the condition by first researching more, working hand in hand with your PCP, that's your primary care provider, or getting more information, asking the right questions, so that way you know more about your specific condition. That way you can stay in control of it. The other thing too is, in order to control your symptoms and your condition, you need to know what symptoms are common. So for example, with diabetes, we know that it's just managing the blood sugar, managing your diet, insulin intake, and things like that. So once you know what symptoms are common, you will be able to identify when anything is out of place or anything is escalating. So that way you know to discuss that again with your primary care provider. The other important thing too is to keep a logbook. So every day, as your symptoms progress or as your symptoms get better, you will be able to take those notes, and then you can present that to your primary care provider. So that way they can collaboratively work with you to stay in control of your symptoms. This could include maybe them decreasing some of your medications or increasing it to help you stay in charge of your symptoms. The other thing too is to stay in good contact with your healthcare provider. So because they know your specific conditions, they probably have run some tests on you, and they have more of your insight into your symptoms. Staying in touch with them will help them to be able to best understand and also help you with more tips to stay in control of your loved one's symptoms or your own symptoms. Again, writing down questions so we can get the right answers when we go to see the doctor is very important. Sometimes we may walk into the doctor's office and then walk out, forgetting some of the questions that we may have had before the visit. So it's always necessary that you jot down all those questions again in your logbook. So that way, when you go in, you will be able to have all those questions answered before you go home to help you stay in control of your condition or your symptoms. When do we escalate back to the healthcare provider or to the hospital? Again, once you get to know your symptoms or your condition, anything that's abnormal, especially with pain, pain should not be to the point where you're not able to have your activities of daily living be able to stay in control of those. Again, if your symptoms are not comparable to what the healthcare provider discussed with you, it's one of the reasons why you have to escalate back to the healthcare provider. So that way they can do more tests, they can investigate more as to why these symptoms are presenting at that point. When symptoms become persistent. So for example, as you get diagnosed, we would run tests, we would start to put you on some regimen, maybe PT, OT, things like that. And so these are things that's supposed to help you stay in consistent, control of your symptoms. So if these symptoms are still persistent, they are still affecting how you achieve your activities of daily living, like, bathing, showering, and things like that, it means there should be more investigation, there should be more tests that should be run. So this is another reason why you have to go back to your healthcare provider to investigate more as to why this is happening. Your inability to stay in control of your symptoms. Again, once you start treatment, the expectation is that your symptoms will be under control, where you can have your life back. You will be able to participate in everyday activities. And so when this is not the case for you after starting a regimen for at least a couple of weeks or so, again, this is another reason why you should escalate back to the healthcare provider so they can be able to best support you.
Thank you. Now we'll transition a little bit over to hospital trips. Although the book Thriving at Home is really all about preventing hospital trips. A key piece is to also avoid a return trip. Okay, and we'll talk a little bit on the next slide. Eunice will get back into, after you discharge, there's critical pieces that you should have in place, because then you're more at risk to going back into the hospital. Specifically, some facts from the Medicare world. Medicare patients are 20% of all, like 1 in 5 Medicare patients go back to the hospital within 30 days of a discharge or of leaving the hospital. So the average, on average, it's 1 in 5 go back in 30 days. So, and if you're at risk of those chronic diseases, it could be even higher depending on where you're at and how well you're able to control your symptoms. So it's likely, though, even if you don't have a chronic condition, that during our retirement years, we'll likely have to go to the hospital at one point or another, or the ER at least. But when you're going to the ER, you don't know if you're going to be admitted, right? So you don't know. So preparing for an admission ahead of a trip to the hospital is very important. And I think the way to think about it is just assume you're going to go right now. What types of thing would you need to bring with you? And some of this stuff is included in the book that you'll get a copy of, so you don't have to write all these things down, but I'm just giving you a little bit of ideas in terms of the things that you'll want to consider. Specifically, in terms of documentation, emergency contacts, right? So who to get in contact if you do become, in a situation where you aren't able to talk or you're unconscious or something like that. Who can they talk to about your situation? Who should they notify? who can make decisions for you if you're not able to make decisions is a very, very important document to make sure you bring with you to the hospital. And that would be the healthcare proxy, who can make decisions for you. Just your insurance information, your medication list, particularly for folks with neurological conditions, where there's a timing of days or days of the week kind of dependency to when the medications need to be taken. Having that and providing that to the hospital, who will likely take over your medications while you're there, is very critical to know that you don't get off balance in your medication regime. As you won't know how long you're going to be there, a good thing and good things to bring are just communication devices, and obviously with your phones or laptops or tablets, make sure you bring charging cables. I mean, these are simple things, but you know, watching that battery level drop and drop and drop while you're in the hospital waiting to get in touch with folks is a hard thing. And there may be minimal visitors allowed, like one visitor per day allowed, only during certain times, because of the pandemic we're in right now. So making sure that we're prepared is definitely going to be helpful. And then just any hobby or fun activities to pass the time, very important to bring with you. All right, Eunice.
Sure. Some key things to do before you leave as well is if there's any new diagnosis, you have to ask more questions about it, what to expect with a new diagnosis. Are there any dietary restrictions at this point? Are there any PT, OT that will be prescribed for you at this point? This is all important information to get before you leave the hospital. If you have any new prescriptions or medication changes, there might be instances where some medications may be stopped and then others may be modified, or new additions to your medication list. Again, you have to find out all that information, where you have to pick it up and all of that before you leave the hospital. Another key thing to do is to find out if you need any follow-up appointments. So if you have to follow up with a specialist or anything like that, again, you have to find out when and where, the contact information as well as the address before you leave. What symptoms and conditions can be expected with your new diagnosis, what to do for your pain. Is it going to be a chronic pain associated with this new diagnosis? Is it going to be under control with physical therapy, or are you going to need pain medications or, visit to the pain clinic? These are all important to follow up before you leave. Before you leave the emergency room, they would obviously give you a discharge instruction. Always try to go through the discharge instruction to find out what the key information is before you leave. So that way, when you get out of the hospital, you don't have yourself, in a position where you're not sure what to do next. Again, it goes back to understanding your condition and your situation, who to call. Typically, they would have you follow up with your primary care, so that way they get in tune with what the diagnosis was, and also to follow up with you as you leave the hospital. So again, it's always good to call your primary care after you leave the hospital and let them be aware that you just had a emergency room visit. And again, schedule your follow-ups and attend them prepared, with all the questions that you need to ask before you go in for that follow-up appointment.
Excellent. Thank you. Thank you very much, Eunice. We're going to try to leave a little bit of time for questions, so I think we'll get through some of these a little bit quick. The next slide is just a quick summary, but just briefly, if you are in need or a loved one might need some help, in the book that you'll get, a whole chapter is dedicated to this, about really what to look for, what to ask, so that you go into the search for extra help at home and in an informed way, and hopefully will likely improve the outcome and the experience that you have and the type of folks and caregivers that you're getting in because of your preparation. So obviously, transitioning in and out of a hospital is critical. So anything they do specifically around transitioning in or out of hospital or rehabs is critical to ensure a smooth transition home, but then also everything that they do to prevent a readmission or return trip to the hospital. As I mentioned earlier, the focus on maintaining independence is critical because we all want to stay doing everything we can do as long as possible. So yes, supporting where needed, but maintaining that independence is critical to doing everything you want to do as much as you can. Having training, we have supplemental training at Assisting Hands, but having extra training for the aides because they might not have had experience in certain situations. The more training that they have only increases their confidence, their ability to handle multiple situations, knowing when to escalate is a piece of that training as well, and they can identify and spot symptoms or changes in symptoms for you. Tailoring care is, I think, just a table stakes these days. But Eunice, would you want to add anything at the bottom of the slide here?
Sure. Also finding out if they have a multidisciplinary staff that works with the caregivers. Again, keeping up with, the caregivers by supervising them by a registered nurse is always necessary. There might be a social worker on the team that can also help navigate certain things, that has to do with your care at home, like coordinating with PT, OT, things like that. Also finding out how the caregivers communicate with your family members, or even give updates to you, the person, so that way you are in tune with what's happening with your care. This can also be very important when you go for your follow-up appointment with your PCP, because then you have real-time information to present to the healthcare provider to show how you're doing at home, and to show how you're progressing, or the other areas that are not going very well, so that way they can address them for you.
Excellent, thank you, Eunice. So hopefully we've gathered some things today. We went through it kind of quick, but packed a lot of information. Not to worry, you'll get a copy of the book, the handbook, so you'll have that information. But I want to leave with you that there are a lot of things that you or family members can do for loved ones. It doesn't have to be, obviously the experience level of a nurse is very helpful to have, but there are a lot of non-medical things that you can do on your own, just in keeping home safe and so forth at home. Just in monitoring symptoms and communicating as well. I'll open it up for some questions if folks have questions, and then there's just some contact information here as well. The email address here, and I can put it in the chat as well, so that you have it, is just thriving at home